Welcome back to Power and Politics. As this country's healthcare system is in crisis, premiers are not just calling on the feds for more help. They're promising to retool their own systems and increase private delivery of care using public money.
Across this country, we have a healthcare system in crisis. So for me, all options are on the table.
The status quo is not working, folks. We need to be creative. We need to come up with ideas from the sector.
I think the answer is there's less and less standing in the way. More and more people are understanding that we have to do things a little differently.
So does the wheel need to be reinvented? Jagmeet Singh is the leader of the NDP. He's with us from Toronto. Hi, Mr. Singh. Welcome back to the program.
Thanks for having me.
I know you're sounding an alarm about privatization vis-a-vis the premiers. I've been listening to their press conferences over the past few weeks. We've had many of them on the show. They are insistent that whatever increase happens through private delivery, it will still be funded with public dollars. What is so wrong with that?
Well, that's inherently wrong. Whenever you fund public delivery through private care through private delivery, what you're doing is sending public money into the pockets of shareholders. We've seen this along with private for-profit long-term care. In that case, every dollar that we spend, public dollars, don't end up in the pockets of seniors or in the care that they receive, but it ends up in the pockets of shareholders. And that is inherently a bad use of our public dollars. We should not be spending public money to make private companies richer. We should be spending public money, particularly in healthcare, to all go towards healthcare. And we know one example where it's been the worst is in long-term care, where the for-profit long-term care homes were where there were the worst conditions of care because of the profit model meant there were corners cut in food, corners cut in hours of care, and corners cut in supplies. And that meant horrific outcomes for our loved ones.
And I certainly do take your point on that, because you're right. The outcomes in those for-profit homes, I know the statistics specifically in Ontario, were worse, much worse than those run with public dollars. However, they also prompted a change in kind of the regime and the regulations around it and the standards to which they have to adhere, which means potentially in the future, the outcomes, hopefully will be much better. There is already a system in which many services across this country, health services, are delivered privately. Is it sort of this, is it too utopian to imagine that should not be the case? Like, is that so inherently wrong if the regulations are there, if the standards are adhered to?
The problem then is the second problem, is that the money is not all going towards care. And that is not a concern when someone is dealing with a private entity that produces a good that people can purchase privately. That's a separate issue. But when we're talking about healthcare and we're publicly funding it, that means we're putting our own public money towards it. I would believe Canadians would feel more comfortable that every cent that we spend publicly went to care and not some portion that went to profit or enriching a company or enriching a shareholder. I feel that doesn't sit well with Canadians, that our public money should go to enriching someone instead of going all towards care.
Again, though, it sounds kind of utopian. And I say that only because I understand the premise behind it and the values behind it. But it doesn't exist in Canada right now. And the problem is so many people across this country are facing really awful situations in the healthcare system, right? Clearly, to borrow a phrase many of the premiers are using, the status quo is not working for Canadians right now. Shouldn't all options be on the table if the standard of care can be maintained?
Well, the problem that we're up against is because the status quo has been one where the premiers, particularly conservative premiers, have been cutting healthcare spending, and the federal government hasn't shown leadership to properly fund our healthcare system. And that is setting up private care as a solution. It's not something that has come about by chance. It's clear decisions made when the federal government continues to fund less and less of our public healthcare system, and when conservative premiers cut funding towards our healthcare system, then they come up with a solution saying that this problem has arisen when they've actually created the problem by underfunding our healthcare system. The solution is very clear. We need to hire more nurses. We need to hire more healthcare workers. We need to properly fund our healthcare system. And we can do that. It's just a matter of priorities. For New Democrats, for me personally, my priority is I want to see a healthcare system that's properly funded, that provides people with the best care possible, and where all of our dollars are going towards care. We can spend money, and we should be spending money in healthcare, But if we spend money in healthcare, that money should go to the care of patients, and it should not go towards profits for large corporations. That is a bad way and a bad model. And we've got evidence that shows when you've got a system like that, the costs go up, the costs balloon, and the quality of care doesn't increase. And since we have this evidence in jurisdictions where public money does go to private delivery, we can show with clear evidence that this means less care makes it to the patients. And that to me is fundamentally a problem. It's not a question of utopian, it's a question of efficiency. And the efficient solution is let's put all of our money towards actually delivering care, hours of care, hiring nurses, hiring them with good wages. Okay. That is a good way to deliver care.
I want to pick up, though, on the point about the federal government and that you want to see them properly fund healthcare. The federal government has said it's a discussion that they're open to. And we're talking, just so our audience knows, north of $25 billion, potentially more than $30 billion for the provinces. That's what they've been asking for. The federal government says, OK, we'll have that discussion, but just don't expect us to write a blank check. There are going to be strings attached. Quebec, in particular, has said that is unacceptable. Is Quebec wrong?
Well, there obviously has to be strings attached. There's no question about it. And there's already a framework for some strings attached under the Canada Health Act that does lay out some strings. It lays out the healthcare principles, that funding for healthcare has to follow those 5 principles of healthcare. And some of those principles include it's universal, it's publicly delivered, it's transferable, people can go from province to province and receive care. So there are already inherently strings attached. We've already agreed as a nation that there would be strings attached to these 5 principles. And most provinces understand. Premier Horgan, responding to this question, said, of course, it makes sense for us to be able to provide clear accounting of where the money is going. And that makes sense that the federal government would require that. That's not a problem at all. What is a problem is the fact that the Prime Minister has refused to meet with the premiers on this issue. A number of times this has been raised as a problem. Premier Horgan has raised that as an issue when he was the chair of the Premier, saying, we've been asking to meet with the Prime Minister, he's refused. And their simple demand has been, meet with us. And given that this is a national crisis, given how serious it is, our major critique of the Prime Minister is that why isn't he meeting with the premiers, and why isn't he stepping up to say we are ready to provide some solutions to deal with this crisis? And we've laid out 3 quick steps that don't even require addressing what is the fundamental question of the transfers, which needs to be dealt with. But we can improve the immigration question around healthcare workers who are qualified here but don't have the status to work. We can accelerate the recognition of their international training. We can invest more in hiring for long-term care workers so we can take some of the burden off of the hospitals that are housing seniors who really should be in long-term care homes and not in the hospital. There are immediate solutions we can do in addition to the long-term solution, which is to properly fund healthcare.
If this is such a specific critique of yours, of the Prime Minister, the premiers have been asking for a very long time for this money. During the pandemic, I remember having them on the program. The pandemic itself exacerbated, what many premiers say was already a crisis in the healthcare system. You decided in your agreement with the federal government to keep them in power, with the Liberals to keep them in power, to prioritize dental care. A variety of premiers, Maritime premiers this week, Doug Ford this week, Premier Ford this week, Premier Horgan in July, all said that would be nice, but actually what we wanted first was help for the system as it exists right now. We want to improve the system before we even think about dental care. Why did you not consult the premiers before drawing that red line with the federal government? You could have actually played an integral part in getting them what they want, but you didn't.
Well, that's where we started. Our first demand in the negotiation around health was to increase the healthcare transfers. That was our first thing that we asked for. That was the most important thing. And we agree with the premiers that healthcare needs to be funded appropriately. We made it clear that that was our first demand. The Liberals were simply unwilling to do it. And it's clear that that is not something that they were willing to commit in the deal. And we said, well, we're going to continue to fight for it. We think it's the right thing to do. We were able to secure an expansion of healthcare to include dental care and pharmacare. But I made it clear to the Prime Minister. I said very clearly that we're going to ask for more because this is important. We need to have pharmacare. It's clear from numerous reports that that is a missing piece of our healthcare system. Dental care is fundamental for the millions of Canadians that have no coverage. But we also know we need to protect our healthcare system, and we're going to demand more. And so he was aware of that when we entered into the agreement. We negotiated hard. We thought that should be the first step. But this is a Liberal government, and they did not agree. That doesn't change the fact that it is a priority for us, and we're going to continue to fight for it.
Respectfully, for all the Canadians who are watching and listening to you right now, who are facing that crisis in the healthcare system, as they hear you say, well, the Liberals wouldn't agree to it, so we just didn't do it, isn't that just a giant missed opportunity?
The Liberals didn't do it.
Yeah, but you still sign. Why sign an agreement when that such a significant issue is something they are unwilling to agree with you on?
Well, the question was, do you get some help to Canadians or get no help to Canadians?
But that help is not what the premiers want. With respect, that's not what they want.
The answer is very simple for me, though. But the answer to me is very simple, right? Given that question, do I get nothing for Canadians or do I get some help for Canadians? We met with millions of Canadians. We spoke with many Canadians, and millions of them have no coverage for dental care. We spoke with people, and millions of Canadians have no access to medication coverage. This is very important to millions of people in our country. So we said we're going to get some help to people. But was it what we would have done in government? No. Is it what I would have done as Prime Minister? No. This is a Liberal Prime Minister, and they have different priorities from us. We were able to get what we could for people, and we're proud of that. But there's a lot more that's needed. And the deal in no way signifies every solution to all the problems Canadians are faced with, but it's a significant victory, the biggest expansion of our healthcare system in a generation. And that's something that we fought hard for. But there's a lot more that's needed. And this Prime Minister is failing Canadians. At the end of the day, it's not because I haven't raised the issue that he's not doing it. It's because the Prime Minister's not doing it. That's his choice and his government's choice, and they're wrong for it.
But are you presenting it as kind of a false choice? Either we could have done a little something or nothing. I mean, in essence, there could be an election, which I know you have argued Canadians don't want. But if, in fact, the Liberals are not acting, as you say, on behalf of Canadians and not helping them where they should, there could have been an election. It's your party that is preventing one from happening. It is your party that's preventing them from being defeated if, in fact, that's the way that you're presenting they are representing Canadians, right? Like, is it fair to just say, well, I got a little something, but I could have got nothing? That's not really true.
Well, it's true, because the other question is a zero-sum solution of every time we're not able to get past, do we push for an election every moment? In a minority government where Canadians chose 2 minority governments in a row, do they want politicians to keep on fighting to go to an election every time there's a disagreement, or do they want Canadians sending a clear message that they want us to find ways to work together? I feel the more difficult thing and the right thing to do is to find ways to work together to get help to people instead of continually threatening and causing election after election. We just had an election less than a year ago. To threaten and to cause another election a year later is not a responsible use of the position that I've been given to help Canadians. It would have been a lot easier to say, okay, you're not doing enough. That's it. We fight in an election. But is that the responsible thing to do in the moment of a crisis of inflation, cost of living going up, in the context of a pandemic where Canadians are frustrated and are hurting from the impact of that, with a war in Ukraine where Canadians feel less safe?
But you say the government's failing Canadians
to go to an election versus is it in the interest of Canadians to try to find a way to get some help to people now? That was an easy choice, that we had to get help to people, and to get some help to people in a meaningful way was without a question the right way to move forward. But we can always withdraw our support. This has not even been it's not even been a year since we've signed this agreement. This has only been months since we've signed it. And we have always the option of withdrawing our support if it comes to the point where we're not able to get the help that Canadians need.
Mr. Singh, I'll leave it there. I'm out of time. Thank you for your time, as always.
Always a pleasure.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.